and it is the general public, or more specific, new mothers or mothers of young children. So antibiotics were first introduced and used around the 1940s, and are certainly one of the greatest developments and advances in medicine, in the world of medicine, to this very day. Every single one of us usually head to the doctor when we start to feel a little ill, and usually when we get towards the end of our visit, the doctor will tend to give us a tiny piece of paper, and usually on that paper is a prescription for some type of antibiotic to help you get back to your healthy self. I've been researching the overuse of antibiotics for several days now, and I have also dealt with being prescribed too many antibiotics personally. I will be persuading you on why we all need to limit the use of antibiotics for illnesses. I will persuade you all on why we shouldn't overuse antibiotics by describing how overusing them can lead to stronger bacteria, 8 major dangers that can arise from overusing antibiotics, common illnesses that we do not need to prescribe them for, how if we continue to overuse them, it can actually set back medical techniques back to the dark ages, and types of alternatives we can use and substitute for these antibiotics. So antibiotics fight bacterial infections within our bodies, and they also prevent the spread of diseases and minimize complications of diseases. We have already overused antibiotics so much that antibiotics that we used to use for standard treatments for bacterial infections are less effective than they were, or they're not effective at all. And that's because every time you take a certain kind of antibiotic, it builds and promotes antibiotic resistance within your body. And once bacteria builds this anabolic resistance, the bacteria can survive in antibiotic treatment and then multiply and pass on the resistant properties to other bacteria within your body. Among those that are becoming harder to treat are pneumonia, ear infections, some sinus infections, meningitis, skin infections, and tuberculosis. Now, these are 8 major dangers that can arise if we keep overusing antibiotics. More expensive health care, extra doctor visits, higher risk of spreading illness because maybe, with those antibiotics taking longer to heal your kids, you'll send your kids back to school because they need to get back to their classes, and you'll just spread it within their classmates because they haven't truly been healed of it. Dangerous treatment alternatives, like if you get a wound, instead of being able to just spread antibiotic cream on it, they may have to resort back to cutting hands and limbs off like they did. Costly tests and indirect health costs, incorrectly taking the medications, because if it's harder to treat, then you may have to take more than what was formerly suggested. Unsafe use of medications and putting your life and others at risk. There are several common illnesses that actually do not require antibiotics that don't need, or that doctors will prescribe some because they may be eager to help a patient out. And these include colds, the flu, bronchitis, most coughs, most sore throats, some ear infections, some sinus infections, and the stomach flu. Actually, doctors sometimes they prescribe antibiotics and they're completely unnecessary. And in spite of growing awareness of antibiotic resistance in recent years, overuse still occurs for a number of reasons. The first reason of those is doctors may prescribe antibiotics before receiving test results that actually show the true cause of the illness. The next reason is people who want quick relief from symptoms, regardless of the cause of illness, may actually pressure the doctor into go ahead and giving them some. And the last reason that they're completely unnecessary, and I found shocking to find this out, is people actually may take antibiotics purchased abroad or via the internet. and I thought that was pretty interesting. If we continue to overprescribe antibiotics, we might have to resort back to Dark Age healing methods. As you can see in this picture here, that the doctor is using leeches on this patient. Leeches were used in the Dark Ages because they were believed to relieve bacterial infections by sucking the blood from your body. And another Dark Age healing method that we may have to resort back to, for example, if antibiotics become too resistant, instead of just grabbing cream and putting it on a wound, we may have to take maggots, because maggots were used in the Dark Ages to eat bacterial infections within wounds and eat dead skin cells. So there are actually several natural alternatives that can help us to slow down the use of antibiotics. The first is garlic, and garlic contains allicin, which has many properties to penicillin, and it has natural antibiotics. It's a natural anti-inflammatory, antiviral, antifungal, and contains antioxidants. The next is honey. Honey has been considered one of the best natural antibiotics, anti-inflammatories, and antiseptics known to man for thousands of years. There's actually a type of honey called Manuka honey, and it has been proven to have very high levels of antioxidants. The next is cabbage. There are sulfur compounds found within cabbage, and it is shown that it even helps fight cancer. And 75% of your daily vitamin C intake is contained within cabbage. The next is grapefruit seed extract. It's effective against more than 800 forms of viruses and bacteria, high in antioxidants, and it even boosts your immune system. The next is raw apple cider vinegar. It lowers cholesterol, risk of cancer, and can be used to disinfect and sterilize, so it can actually help you prevent getting the illness in the first place. The next is extra virgin coconut oil. It can be used to boost your immune system, balance your thyroid, help with your cholesterol, your blood sugar levels, and even improve brain function. The next is echinacea. It helps stimulate the immune system and boost infection fighters within your blood. The next is fermented foods, and they're packed with antioxidants, and they help maintain the good bacteria within your body. The next is colloidal silver, and it helps fight bacteria and viruses. And the last is oil of oregano, and it helps with treatments of wounds and skin infections, and helps with respiratory problems as well. I've talked about how the overuse of antibiotics will lead to stronger bacteria, 8 major dangers that could appear if we continue to overuse antibiotics, common illnesses that we do not need to use them for, and how they could set back medical techniques to the Dark Ages, and different types of alternatives we can use to help slow down the use of antibiotics. I've now given you several reasons why we should limit the use of antibiotics for illnesses. So the next time you decide to go to the doctor, make sure that you truly need that antibiotic in order to get yourself back to 100%.